Hello everyone, welcome to my video channel. Today I am going to talk about joint hypermobility and the Beighton Score. In this video, I will cover regarding joint hypermobility definition. Number 2, the Beighton hypermobility score. Number 3, each of the score is going to be explained. Number 4, the mainstay of treatment for joint hypermobility. And finally, what is the diagnostic criteria for benign joint hypermobility syndrome, BJHS? Joint hypermobility is not a diagnosis, but a descriptor used to define a joint that exceeds its normal range of movement ROM, taking into account the age, the sex, and the race. This feature is predominantly determined by the tightness or laxity of the ligaments, which in turn is influenced by A. Genetics, B. Connective tissue genes collagen, C. Elastin, and fibrillin. Okay, got it? Then next, as a consequence, heritable connective tissue disorder, HCTD, like the Ehlers-Danlos syndrome, EDS, Marfan syndrome, and osteogenesis imperfecta, OI, result in systemic ligamentous laxity and can present with generalized joint hypermobility. Okay, got it? Then we are going to the next slide. Okay, what is Beighton hypermobility score? It is a simple system to quantify joint laxity and hypermobility. It uses a simple 9-point system where the higher the score, the higher the laxity. The threshold for joint laxity in a young adult ranges from 4 to 6. The score above 6 indicates hypermobility, but not necessarily a true BHJS, benign joint hypermobility syndrome. It is defined by Beighton Score. 1. Ability to touch thumb to the forearm. We give 1 point for each side. Number 2. The fifth finger metacarpophalangeal joint MCPJ extension more than 90 degree. We give 1 point for each side. Number 3. The elbow extension more than 10 degree. We give 1 point for each side. Number 4. Whereby the knee extension is more than 10 degree. We give 1 point for each side. And finally, number 5, ability to touch thumb palms flat to the floor with knee straight, we give 1 point. Okay? Next, I will explain more about each of the score. Number 1, the ability to touch thumb to the forearm. 1 point for each side. Example, if the left thumb is able to passively dorsiflex to the flexor aspect of the forearm, I will give 1 point. If the thumb cannot be passively dorsiflex to the flexor aspect of the forearm, there will be a 0 point. You will see from this video. What I mean, I did a slow motion for this video, and you can see whereby the thumb is able to passively dorsiflex to the flexor aspect of the forearm. For number 2, the fifth finger metacarpophalangeal joint MCPJ extension more than 90 degree. we give 1 point for each side. The finder would be that the little finger or the fifth finger is passively dorsiflexed beyond the 90 degree. If the little finger or the fifth finger is able to be dorsiflexed beyond the 90 degree, I will give 1 point. If less than 90 degree, 0 point will be given. For number 3, if the elbow extension is more than 10 degree, 1 point will be given for each side. For example, if the left elbow is able or hyperextends beyond the 10 degree, I will give 1 point. If the extension of the elbow is less than 10 degree, 0 point will be given. For number 4, if the knee extension is more than 10 degree, 1 point for each side will be given. Example, if the right knee able to hyperextend beyond the 10 degree, 1 point will be given to the patient. And finally, number 5, the ability to touch the thumb palms flat to the floor with the knee straight, patient will be given 1 point. Or in another word, forward flexion of the trunk with knees in full extended and the palms and the hand can rest flat on the floor, 1 point will be given. Scores of 4 or above indicate generalized joint hypermobility. It may be asymptomatic or associated with joint pain that is exacerbated by exercise, dislocation, and fatigue. Chronic pain often leads to muscle weakness. Other associations include dizziness and syncope and gastrointestinal problems. Example, chronic abdominal pain and constipation. The mainstay of treatment is always physiotherapy and exercise to strengthen the muscle around the hypermobile joints. Exercise to improve the balance and coordination may also be helpful as proprioception may be impaired. Occupational therapy input may be beneficial to the patient. So we are suggest to advocate the patient for exercise. The diagnostic criteria for the benign joint hypermobility syndrome BJHS. BJHS is diagnosed in the presence of 2 major criteria or 1 major and 2 minor criteria or 4 minor criteria. 2 minor criteria will suffice where there is an unequivocally affected first-degree relative. BJHS is excluded by the presence of the Marfan or Ehlers-Danlos syndrome. Okay, I will explain about the major criteria after this. Got it? For the major criteria, it involves a Beighton score of 4 out of 9 or greater either currently or historically. Another major criteria is arthralgia for longer than 3 months in 4 or more joints. So for the minor criteria, it involves a Beighton score of 1, 2, or 3 out of 9 or 0, 1, 2 or 3 if patient is age 50 and above. There is a arthralgia more than 3 months in 1 to 3 joints or back pain more than 3 months The back pain can be diagnosed as spondylolysis, spondylolisthesis, dislocation or subluxation in more than one joint or in one joint on more than one occasion. Another minor criteria include soft tissue rheumatism, more than 3 lesions, example, epicondylitis, tenosynovitis, bursitis. Patient also might have a mavanoid habitus, whereby patient is tall, slim, the span to height ratio is more than 1.03, the upper to lower segment ratio is less than 0.89, there is a arachnodactyly, whereby there is a positive Steinberg or Rees sign. Another abnormal minor criteria is abnormal skin with striae, hyperextensibility, thin skin. The eye signs involve drooping eyelids or myopia or anti-mongoloid slant. There will be a varicose vein or hernia or uterine or rectal prolapse. So, again, either 2 major criteria or 1 major and 2 minor criteria or 4 minor criteria is sufficient to diagnose the benign joint hypermobility syndrome BJHS. Okay, that's all for today. I hope you have learned something from this video. Till we meet again, see you and bye.